Hi, everybody. Thanks very much for coming to session 5. And we really appreciate the time that you're taking to come regularly to these sessions, including everybody online. This week's session is about testing for sexually transmitted and bloodborne infections, so STBBI. And we're really happy that today's speaker is Dr. Megan Jones, if I said it correct. She is a second-year internal medicine resident here at the University of Manitoba. Megan works mostly at Health Sciences Centre and also at St. Boniface Hospital. For nearly 2 years, she's been working with Dr. Rueda and Dr. Kanan on a research project looking at the relationship between HIV and other STBBIs, like we've been talking about. And she contributed to the data that was included in the 2018-2021 Manitoba HIV program report. She's had a chance to share the information with folks like yourselves and people across the country. I think you're going to a conference later this month to talk as well about the data in general terms. So thanks very much for coming, Megan. We're going to start with the pre-session. It's called a test, but that's not fair. Let's call it a survey. And just have everybody take a moment or two to fill it out. And drill. It just helps us know if we're achieving what we're trying to do. You did a pen? Yes. Well, please one. I do. You have to put your name. Hi, welcome. Hi. Hey, Kristen. Just starting everything. Thing.
Oh, how's that the audience? How's the audience? I was going to go with the email over. So I ran over here.
Oh, God. Right, this is your first question, but we do, you can take a minute to go on the today, but we generally ask them to just fill out. And then after that, we can do a post session test. This would be. Yeah.
Any replies yet online, Mariana?
Just the person joined.
Okay, cool. So we'll give them a few more minutes.
Yeah.
Yeah, interesting.
You want me to choose it for you, or?
I know.
Got, actually, there's only two kinds.
Test.
What's the best one?
Number 3, what can test we have?
I think it's still referring to STBBI. Good question.
Yeah,
Maybe
that
the
is
question
like-
as well.
What kind of what kind of different types of testing are there?
So different kinds, it doesn't have to be.
So, I'm trying to think, there you go.
Show you here because sometimes it's controlled.
Sometimes you have to. That's nice. Even though it's hard.
Yeah, right, like, yeah,
Disney.
If you're done, please raise your hand and I'll come. Anybody else? Hey, thank you. Okay, so I think we'll get started. Yes, go ahead, Megan.
Okay, hopefully that working now. Yeah, so awesome. Cool. My name is Megan. As mentioned, I'm a resident doc just over at HSC, and I've been working with the HIV here in Manitoba on research around sexually transmitted bloodborne infections. Thanks so much for having me here today. I'm very excited to give this talk. So there we go. So our agenda for today is to kind of talk about different types of testing for sexually transmitted and bloodborne infections, and what kind of some of these different testing words mean. What are the common types of tests for different infections, because they differ for different types of infections, and then what we have in Manitoba, and then we've got some samples here of point of care testing, which we'll talk a bit more about what point of care testing is, and kind of how those can be used in the community. And just interrupt me at any point in time if you have questions, okay? It's supposed to be like really interactive, okay? And I know that a whole talk was given on what STBBIs are already, but just to kind of refresh, these are infections or bugs that are spread through sexual contact and through blood contact, right? So through things such as sheared needles or sexual contact. And these infections can include things like chlamydia, gonorrhea, HIV, as well as others. So why is testing for these infections important? Well, without testing for them, we can't really treat people. So we need to have a way of detecting these infections. And that's why there's so much interest in detecting them. We can also then, by doing lots of testing or screening, figure out what groups of people are more at risk of infections. And so then that way we can make sure that we target those at-risk groups to try and help those populations. And this can help the spread of infections. So if you think about the COVID pandemic that we're hopefully all soon getting out of, by testing people, you then know that you can treat people, and you can also then make decisions on how you can then limit the spread of that infection. And it's quite similar actually with these bugs that cause these sexually transmitted infections and bloodborne infections. So the first kind of part of this talk is just going to be looking at, actually before I go into that, does anyone have any questions about any of that? All makes sense? Equal. If it doesn't, you just let me know, okay? So part one, we're just going to talk about what are the different broad kind of categories of testing. And so in recent years, one of the biggest kind of areas in this realm that's kind of become more of a thing is point of care testing. And what that means is these are medical tests that happen at or near the point, the time and place of patient care, meaning that somebody comes in, we test them, and we're immediately able to treat them. You diagnose them and you treat them right at the same time. So here what we're actually seeing is something called a point of care glucose testing or sugar testing. So for people with diabetes, they can check their sugar, and you get a sugar back right away, and then you can treat them right away. You have a number and you can do it right away. It's right at the bedside that this testing happens. And this is a new kind of way of testing people for HIV and other infections. And the reason that this is important is kind of, I like this little picture because it kind of shows you why point of care testing or POCT can be helpful. If you've got somebody who's sick and they come see their doctor has to make a decision, well, why are they sick? Then the doctor sends off a test that goes to a lab, and then it takes some time for that lab test to get back. Then the doctor has to get the patient back in to the clinic to give them their treatment, right? And that's kind of classically how things are diagnosed, is that we send people come in, doctor gives you a requisition, you go to a lab, you get blood work, and you come back. But with point of care testing, kind of get rid of this messy step right here where someone comes back, you just do the test in the office. Yeah.
Is there other types of rapid tests?
Yeah, there is. And so it's not just for things like glucose. There's things like, what we're going to talk about is you can do point of care testing for HIV, for syphilis, for gonorrhea and chlamydia are a bit harder to do point of care to, but there are tests out there for it. They're not as available in Manitoba, but there are like for, yeah, lots of different infections, and it's kind of very similar to, hopefully, I mean, I was gonna say, hopefully by now we've all taken a COVID test, but maybe you somehow made it this far without needing to take one. That's an example again of what can be done, like point of care, where somebody can come in with those symptoms, you do it, you treat them right away. That makes sense? Can I answer the question? Please. So yeah, you get rid of that extra step. And so that's kind of a new way of testing that is up and coming that we're going to talk about quite a bit today. Then there's rapid testing and self-testing, which is very similar, but these are medical tests that can be done at home in the community. So similar to a point of care test where you get the answer right away, these, you get the answer very quickly as well, but they're designed in a way that you don't even need a doctor or a nurse or anybody in a, hospital or clinic setting to do the test for you. They're designed in a way that anybody should hopefully be able to, with some education, be able to use the test and be able to get a diagnosis made at home or in their community. And this is huge for the population we're talking about today. People living with HIV and people who are experiencing STBBI. Yeah.
What does education have to do with knowing how to do this test?
Yeah, so I think that, most of these tests are pretty straightforward, but I found I've used some of the like the point of care HIV tests. They're pretty simple to use, but I think it does involve some learning on just like how you do it. Like I think the first time I took one out, I kind of looked at the kit and I was like, okay, so like almost like the COVID test, you had to read the little thing. I no longer need to read the instructions for the COVID test. Kind of like similar to these. It's not that you really need like a lot of education to use them, but you need to, I guess, have a sense of the test is what I mean, if that makes sense. Yeah. And so they've got pretty good instructions in the packages, but it's kind of nice to, today we're going to try and walk through some of those rapid tests. We've actually got the same one that's up here. So these are tests that can be done by yourselves, by anyone in the community. And then we talk about confirmatory or lab-based testing. And this is the more kind of classic way of testing for infections, where you come in, you get blood work or any sort of body fluid sample, and then those results go to a lab to make a diagnosis there. The results get sent back to some sort of healthcare provider who will then contact a patient. And so these can also be helpful to confirm the results of these screening tests, because as good as these tests are, these point of care tests, we can't use them to actually definitively or like for sure say that somebody has an infection. So they're helpful to say, okay, it's positive, you probably have HIV, but you still then need a confirmatory test, which is done at a lab. Okay. So what are these tests actually detecting? Like what are they picking up to figure out that someone has an infection? It can be lots of different things. It can be antibodies, which are a part of your immune system that fight against infections. Whenever you get a cold or any type of infection, you get antibodies against that bug. And so when somebody has a syphilis infection, you develop antibodies against syphilis. We can also detect the actual bug or the organism that's causing the infection. So you can detect the HIV virus or the gonorrhea bacteria, or it might be even just a little part of the organism. So even just kind of like, this is a picture of some DNA, so some like genetic material. It might just be a little part of the bug that we're detecting to figure out if somebody's got that infection. Okay, so there's like different strategies depending on the different tests, like depending on the different bugs that we're trying to detect. So that's part one. Any questions about that? No? Okay. So part two, we're gonna kind of talk about what type of samples do we actually need for these tests, because they're not all the same. And then what tests are available for the different infections, okay? We're gonna walk through a bunch of different infections. We'll start with HIV. So the types of tests that we've got for HIV include tests of the blood, as well as oral swabs that can be used. And there's actually lots of different types of testing. You know, antigen and antibody testing is kind of like what we talked about when you've got those, that immune system response that's fighting an infection, so you can detect antibodies against HIV. The NAT and PCR, those are like terms that basically are detecting genetic material again. So the DNA, or the genes of HIV, you're actually looking for what we call RNA, or just a type of genetic material. And then there's the point of care testing, which is what we've got here and what we've talked about with where you're able to do it either at the bedside or at home.
Have a question?
Oh, yeah.
Does drugs and alcohol affect the result?
No, they won't affect the results at all, actually, with these tests, because these tests are looking at different, like, they're looking for parts of that genetic material, or they're looking for the bug, so they won't affect the test.
Sorry, can you repeat the question?
Oh, yeah, sure. So the question was if drugs or alcohol could affect these tests, which they won't. Because the tests are looking like specifically parts of the bug or your immune system fighting that bug, they won't affect the tests at all. A good question. Somebody else? Okay. So in terms of the HIV point of care testing, we'll talk about this a little bit more when we look at one of the kits, but they take about 5 minutes to use. Some of them take a little bit longer to wait for your sample, but it's quite quick to actually like do the testing here. It's highly sensitive and specific, which means that it's very good at what it does. It picks up most people who have it, meaning that the test, if it tests positive, a lot of the time that means you're positive. Negative, most of the time it's negative. Like anything, not perfect though. And the results are what we call preliminary, or you need that confirmatory lab-based testing. But it's very helpful, right? Because if you're negative, we can say you're probably most likely negative. It may miss some HIV cases though, and this is because you need to have had HIV for a little while for most of these tests to pick it up. And that, the easiest way to kind of think about that is that if you haven't had HIV for a while, it's hard to actually pick it up in the blood, you know? And so it takes a little while to pick it up. And once we've been able to detect it, then the tests are quite helpful. These are available in Manitoba, and you can anonymously, or without, you know, saying who you are or why you need it or who it's for, pick these up across a lot of different places in Manitoba, and we'll talk about where those are. In terms of tests for follow-up, we've talked about this a little bit, but yes, there is tests for follow-up for HIV. Once you've had a positive test, people are actually then connected to the HIV team, and then follow-up blood tests can show us how much of the HIV virus is in a person's body. So once somebody's had either a point of care testing or an at-home testing done, they would get a confirmatory test at a lab done. And then after that, they would be followed in a clinic, and we can actually then in their blood look at how much HIV is there until it's undetectable. And so that's the goal of treatment, right? Is to then make it, we keep testing until you don't even have any HIV in that is detected on those tests. The test results can be positive or negative for this. So moving on to chlamydia. So for chlamydia, the most common way to test for chlamydia is with a urine sample. Okay, that's for both males and females biologically, like urine collection for all sexes. For women, or for females, I should say, an endocervical swab is a potential way of detecting chlamydia. So it's not as accurate as a urine test, actually. And same with for males, a urethral or a penis swab can also be used. Depending on what someone's symptoms are, you can actually get chlamydia in the throat. And chlamydia can also kind of be in the bum and in the penis. So these are other places where you might swab for chlamydia. And in terms of what we're picking up, and just kind of like the types of tests that we're doing, it's mostly genetic material that you're again detecting from that bug. And unfortunately, there's no point of care testing.
If somebody were to get chlamydia in the eye or in the ear, what kind of treatment is it?
Yeah, so that's a good question. So similarly, so like you raised a good point, you can get chlamydia in the eye, especially important for little like babies actually. When women, again, I should say females, sorry about that. When females deliver, you know, if they have chlamydia, a lot of the time it's actually newborns that can be at risk of eye chlamydia. In terms of treatment, it's usually the same sort of treatments that we would be doing for chlamydia anywhere, which is antibiotics. So it's an antibiotic, typically what we call a cephalosporin, which is not really too important probably to know, but it'd be an antibiotic that we'd be treating. And you're right, you can get chlamydia in your eyes, in your ears, in the nose, in the throat. It can actually go anywhere. Sorry, I didn't repeat the question, but the question was about chlamydia in the eyes or chlamydia in the ears and how that would be treated. And so just like anywhere, it would be treated with an antibiotic. But yeah, unfortunately, there's no point of care testing, which would be very helpful to this. It's why a lot of the time when we test for chlamydia, we actually treat at the same time, because it's better to, if someone seems like they have chlamydia, when you see either the symptoms or if it looks like they've got vaginal discharge or discharge from their penis that looks like it could be a chlamydia infection, a lot of the time we actually just treat it. And then we do the testing anyway to make sure that we were right, that it is chlamydia, because it's important to know that someone had chlamydia, right? Because if they did, then for their partners, we want them to know that they are also then at risk of chlamydia, okay? And so in terms of testing for cure, we actually don't typically do this, meaning that when someone has chlamydia, you treat them, and you might wonder, well, how do I know that my treatment worked? And unlike HIV, where we test to see if the treatment is working, we don't do that for chlamydia. And so unless somebody has been treated and they're not getting better, or if they've been re-exposed to chlamydia, or we're concerned for certain groups like kiddos, like little kids, children, teenagers, people who are pregnant, then those populations, we actually do repeat testing to make sure that they no longer have chlamydia, okay? Let's move on to gonorrhea. It's very similar to chlamydia, so I kind of spend too much time on it, but similarly, we use a swab, okay? Urine and all the same sort of body locations we just talked about. Ears, nose can have them, but the throat a lot of the time, and then the vagina and the penis can also be places where you'll get these infections. And the testing for this is similarly kind of pieces of the bug, which is the genetic stuff, or a culture where you try and grow the bug in the lab. And also just like chlamydia, we don't have tests to do at home for gonorrhea. And also very similarly to chlamydia, we don't test for cure, meaning that you do the test, you have gonorrhea. We don't bother testing to see if you don't have gonorrhea anymore, unless it's kind of a strange infection. It's quite odd to have gonorrhea in the throat and can be quite dangerous, so that gets tested again. Or if we know that they're pregnant, if there's been problems with treatment in the past, or if they have what we call a disseminated infection. So that would be when the gonorrhea is everywhere. Yeah.
If there's gonorrhea in the nose or somebody sharing saliva, can it be transferred?
That's a good question. I actually don't think so, but I can't. The question was, can gonorrhea be transmitted through the throat if you were sharing saliva? And my gut answer is that it shouldn't, because gonorrhea is typically only spread through sexual contact or through blood. And so kind of similarly to any of these infections, things like kissing and things like sharing saliva shouldn't cause a problem here. The throat infection is typically near the back of the throat. Now oral sex here, or oral sexual practices would put you at risk. Yeah, there's a question in there too as well.
One question online from Jacqueline. Can someone be co-infected having two STBBIs excluding HIV and HEPC?
Okay, for sure. We'll get to that one once we finish. Yeah, does that answer the question? It probably wouldn't unless there was like deep throat kind of like penetration. And then the next question was, can people have two STBBIs at one time as a co-infection? And I think the example was such as HIV and like hepatitis C.
Excluding HIV and.
Oh, excluding those. Absolutely. So it's a good question as to whether or not you can have more than one. And you can have actually all the infections that we're talking about today at the same time. And we, a lot of the time, end up treating people for multiple infections all at the same time. So just because you have one of them, just because you have gonorrhea, doesn't mean you don't have chlamydia. And a lot of time they actually come together, those two. And just like if you have HIV or syphilis, or any of these other infections, you can absolutely have another one. Okay. It's a good question too. Great. So moving on to syphilis. So syphilis, there's lots of different types of tests, and really, really great that there's now point of care testing, or those POCTs that people can do at the time of treatment, because that means that we can make the diagnosis and treat people right away, give them their first dose of antibiotics that they need. A lot of the time it's with blood testing, okay, but depending on how someone's presenting and how they have their syphilis, it might be other body fluids. So sometimes people with syphilis have no symptoms at all. Actually, a lot of the time when we pick up syphilis in the community, it's that people had no symptoms whatsoever. But that being said, there's also lots of symptoms of syphilis, which I know, I think Dr. Keenan talked about a few weeks ago, that, you know, symptoms of rashes, ulcers, those sorts of things. And if that's the case, then you might actually do a swab of the wound that someone has, or you might do a swab of the urethra, so like the penis or the vagina, and do a swab there if that's where someone's symptoms are, because you might pick up more pieces of that syphilis bug. There's different types of testing for syphilis. There's screening tests, and then testing that's for confirming that someone has syphilis. And so typically we actually send off just the screening test first to see, oh, does it look like they have syphilis? And then we figure out, well, how much syphilis do they have? And then that's more helpful for then monitoring treatment. So there is what we call a test of cure here to see, does someone no longer have syphilis? So we do blood testing, usually 3, 6, and 12 months after someone has a syphilis infection. And it can be longer depending on the type of syphilis that this is. And you do those tests after people have gotten treatment to make sure that the treatment is working. Sometimes with syphilis, it can be quite difficult to treat it. And so by doing repeat blood testing, we see that 1, that our treatment is working, and 2, that someone hasn't gotten a new infection in the interim, like in the time being, okay? We'll just touch briefly on hepatitis C and hepatitis B, okay? So these are both blood tests. They're again like an antibody test. So again, looking at parts of your immune system fighting against the hepatitis infection. Now, the hard part with this is it can take up to 14 weeks. So like over 3 months for hepatitis C to actually, like for your body to develop antibodies against it. So you get an infection, and it might not be for like 2 or 3 months that you actually are able to detect hepatitis in the blood. And so that makes it kind of difficult, right? Because if you think that you've been exposed and that you're, that you might have hepatitis C, it actually can take quite a while before we detect it. So that's kind of an area where hopefully there'll be better tests. Sure. There is tests of cure here too, where we can see to make sure that somebody's being treated appropriately. And that's by looking at genetic material and just seeing, you know, when we diagnose, oh yeah, you have hepatitis C, then we could look at what are the levels of the hepatitis C virus until they're completely gone. And so that's really helpful to know if they've been treated. Yeah.
I have a question. Is it possible to, have antibodies show up for hepatitis C, but not develop hepatitis C infection?
Yeah, so that's a really good question because you can definitely develop antibodies against it if you've been exposed to it, and you might not ever have a clinical infection. The question was about hepatitis C antibodies and whether they can develop without a clinical infection, and whether then the other part of that is whether it can be cleared, which it can. So you can actually have antibodies against hepatitis C and never have the RNAs sitting around, and you actually completely clear the infection on your own. So some people don't actually even need treatment for this because their body's able to fight it off if they were exposed to it at some point in time. So that's a really good piece too. Not everybody who has hepatitis C actually has trouble with their liver or symptoms of hepatitis. Hepatitis B is similar in that it's a blood test kind of only, and it's also an antibody test. And unfortunately, there's no point of care testing for hepatitis B. Yeah.
Why did it wait so long for treatment?
For hepatitis C?
Yeah.
The question was about why do we wait so long for treatment for hepatitis C? Now, it depends on when, like what the condition is in terms of their hepatitis C. So there's a couple pieces there, right? So it depends on when someone was diagnosed. It might take a long time to actually diagnose hepatitis C, because by the time you get that first test back, that screening test, you then need to get that more confirmatory test, the RNA or the genetic material.
No, because they wait until something's wrong with the liver before they can treat.
Yeah, so it depends on so certain things depend on treating hepatitis C. It's more on a like case by case basis, actually. And the reason for this is that the hepatitis C treatments, unfortunately, in Canada and actually across the world, are very, very, very expensive and quite difficult to treat. And so typically they'll wait if somebody is not symptomatic. There's a lot of people living with hepatitis C who don't need treatment necessarily if you don't have that RNA sitting around. And then the other piece is that we actually want to make sure that somebody's not going to get hepatitis C again, because if you're going to commit to treatment, the standard kind of what happens in Manitoba is that we want to actually help people from a social standpoint before you treat them with hepatitis C. So if let's say somebody has hepatitis C and the thought is that they probably acquired hepatitis C because they're a person who injects drugs, then it's actually been shown that it's better that we focus our resources on getting them help for their drug use and making sure that they have access to needles, potentially helping them with injections treatments, than treating the hepatitis C. Because if you treat it, it's not like it goes away forever if you don't stick to those treatments. And so that's why, I'm not sure what, I'm not sure who you may or may not know who's had hepatitis C, but depending on the case, it's kind of a case by case basis as to whether or not you need to treat right away, or if you wait and kind of focus on other things. Does that make sense?
You have a question online from Lisa. Is treatment pills and how long?
Yeah, so the treatment for hepatitis C, I'm guessing this is about with, and the question is about the pills. Yeah, so the pills, I'm not exactly sure how long it is, but I believe that it's like months of treatment, but I would have, yeah, I think it can be as little as that, but it's usually, I want to say a couple months. But I'm not completely sure, to be honest, off the top of my head. Any other questions right now? Okay, great. So that's all of the STBBIs we're going to talk about. And so we'll go into part 3, which is just looking at what are some of the actual resources in Manitoba where we can get these tests. I think this is probably actually the most relevant part of this is, well, where can we actually get these tests, and then how do we distribute them to the people that need them? So there's lots and lots of great resources in Winnipeg. Unfortunately, less I'd say probably outside of Winnipeg. But some resources that are worth knowing about. Street Connections, of course, is a great mobile health service, right? That runs a van around Winnipeg. And apart from, doing stuff with safe drug supplies and safe needles, they also, can do testing, point of care testing for HIV, and other STBBIs, including hepatitis C. And so they also, I think, are starting syphilis treatment too. So, their website is there. It's really, really good because it shows you the times for when, that bus is going around, when the van's going around, and can offer these treatments. Teen clinics are found kind of all throughout Winnipeg, which is nice. And the teen clinics are really helpful for like our younger populations out there, and provide resources on these types of tests and can do them in the clinic. This website I find is very helpful, the Sexual Education Resource Center in Manitoba. So it's got a whole big list of all of the different places that you can get tested. And if people are interested, we can like look at some of these websites if you want, and we can pull them up. Because this website's really great. It kind of gives you the big full list of where you might be able to get education around STBBIs, as well as where you'd be able to get tested. This is an interesting campaign that's kind of going across the country called the Ready to Know campaign. Has anyone heard of this? No? Yeah, okay, cool. Oh, there's a question or? Yeah.
There's a question from Lisa.
Yeah.
How many STBBIs have vaccine and are they researching for a vaccine?
Yeah, so that's a great question, Lisa. So Lisa's question is about vaccines and if there's vaccines for these STBBIs. And it's absolutely something people are looking at. We don't have them available right now, though. There's a vaccine for hepatitis B. So that one that we talked about has a vaccine. But other than that, and HPV, which I didn't touch on today, but like the human papilloma virus, HPV has a vaccine, and so does HBV, so hepatitis B. But the other ones are a work in progress. So, you know, there's a lot of research looking into an HIV, specifically an HIV vaccine, because of the problems that you know, HIV is causing for so many people across the planet. So that's something that people are looking at. Same with hepatitis C. It causes a huge burden of liver disease. And so these are things being looked at, but they're not developed yet. Good question. So the Ready to Know campaign, yeah, is a campaign across the whole country, actually, about that's looking at the research project, actually looking at getting kits to people testing for HIV. And so they actually have like where you can get a kit in Manitoba, as well as anywhere across the country, actually on their website. And then they actually give you a bit of a, like I've got it, the page I screenshotted was just the Manitoba Care Pathway. So you can like kind of go through these different links and eventually get to what to do if you're in Manitoba. And if you were to scroll down from here, it tells you like what to do about your negative test, what to do about your positive test, and where you can kind of get more information. It refers people to 9 circles, and gives people some idea of what they can do with that information from their testing. And so it's a great resource. Actually, I find it very approachable. Like the language is very nice and like helpful to like very easy to understand, which is just really nice. This is a fun title for a website, but it's the Syphilis Manitoba website. But syphilis is still a thing. I think that people think that syphilis is an old infection and it's been around, you know, for actually hundreds of years. But syphilis is still a big problem in Manitoba and across the country. And there's a huge increase in Manitoba in our syphilis numbers. We're unfortunately seeing, especially in our population, living with HIV, huge increases in the number of people who also are suffering from having a syphilis infection, and that causes all sorts of problems as well with having HIV. So this website gives you, again, lots of resources on where you can get tested and what to do with a positive result and where you can get follow-up. So it's just syphilismb.com. It's ran by like the WRHA or the Winnipeg Regional Health Authority. And then 9 circles, of course, which I'm sure people are familiar with their clinic and the great work that they do, has wonderful information on like the type of test, which we've talked about all day. You know, we've talked about blood tests, urine tests, that sometimes we do swabs. Pap smears are important for things like HPV. So they have really good page too on the types of treatments and testing that are available. And Nine Circles kind of has partnered with this website called Sex Friendly Manitoba. And I think if you have more questions like after today or at all, like this is a great website to ask them. So it's just sexfriendlymb.9circle.ca. And what you can do is you can actually ask them any question about anything, but typically the questions are about like a sexually related question. And so, for example, you can see kind of like the top of this question was somebody had asked, can I masturbate after a shot of penicillin or during my treatment of syphilis? It's a very fair question. And yes, you can. So there's an answer to it, right? And so it's an anonymous website where you can ask anything, and a healthcare provider will help answer it for you. And it's run in partnership with Nine Circles. So that's kind of the end of all my talking. Thank you so much for listening. We're going to take a look at some of the point of care tests and the kits. I think I'm happy to do that now. I'm pretty much done. I'll just kind of maybe summarize what I'm talking about, and then we can look at those. The big takeaways, I think, are that there's lots of different types of testing out there for these STBBIs. And that I think at a community level, the point of care testing and at-home testing has a real big important role in terms of picking up people who have these infections, because we can detect them right away and then start treating people right away. We can also do it, in people's communities. You don't have to, for some people, they don't want to come to hospitals.
Can we do that in our community too?
Yeah, and
At our local nursing station?
yeah, so that's the beauty of these point of care testing. Exactly. So the question,
But is there a training for the CHR who's taking care of the health? Do they do it to the person who applies for these treatments?
so I don't know the answer to that specifically. The questions about generally is about whether or not these tests are available and whether people are trained right in kind of more remote communities, such as up in nursing stations. And that's where the point of care testing I think is very helpful, because these tests, as we'll soon find out, are very easy to use ultimately. If you've ever used a COVID test, you can probably use this. And so that's where they're really helpful, is that there's not much training that's actually needed to do these tests. And they're very transportable, like these. So this is an HIV test, it comes in just a little tiny package. And so this is where this is hopefully a big game changer for detecting these infections, especially for communities that are more remote, because you used to have to, come to a lab and get it done. And it's we're flying people to Winnipeg for certain things, whereas this can be done anywhere.
We're actually gonna, at the end of Megan's talk, we're gonna do HIV and syphilis, so everyone can have a feeling of how we can do those tests. If you want to take some that we have and do them and distribute, you can show people how to do them. We can have a hands-on.
Yeah. And that's what I think we should, we'll focus on actually right away, because I think that's the most important thing probably here, is to kind of get a sense of point of care testing. Hopefully my talk kind of explains why it's so important to get these tests done. As we can see, Manitoba has a host of resources for STBBIs, which is
for instance, our youth too, our youth people, they don't even understand what that is.
yeah.
You know what I mean? Even though they go to school and they teach them health, and then they don't understand what STBBI means
Yeah.
and gonorrhea and all that.
And that's a huge problem, right?
Yeah, that's a huge problem.
Yeah,
with these people who don't understand what does it mean and what does it do to you, and what to watch out for.
absolutely. No, it's a huge problem. And it's where that education piece, right, can't be understated, right? Like,
Yeah,
you're right,
exactly.
that the education here is very, very important.
Yeah.
I think the nice thing about these tests and like point of care testing and some of the clinics that do the testing very anonymously is it takes away some of the stigma that surrounds these, right? But it's, you know, but it's not.
That's
something-
that's how I've been, I had a lot of, they did a lot of stigma on me since I'm HIV positive. And then they just pushed me out of my reserve. And then I had to come down to one place, look for support, so I won't get spread down there.
Thank you for the work you're doing, you know, like I'm sorry.
I'm still trying to help these young people to understand about it.
Yeah, and that's like the huge piece, right? It's like,
Yeah,
if
exactly.
you don't educate people, it doesn't matter how good these tests are, if they're
Yeah,
not
they
gonna
don't
use them.
even, they don't give a shit
Yeah,
about
and that's the thing, if
that.
you don't, yeah, if people don't have the education, then they won't be able to do it.
Exactly.
Yeah, there's a question in the back?
So Lisa said, for testing, how young people can they be tested? And if they talk to a doctor and say they're sexually active, can they get vaccinated for it? And at home test kits being approved.
Yeah, so the questions are, there's a kind of three parts there, I think, so there's a question about, whether, like, how old someone, can kind of get these testing at, and if somebody's sexually active, can they get these tests at their doctor and vaccines? And so these are great questions. So in terms of age, if you're sexually active, you should be tested for STBBI. Everybody who's sexually active should be tested for these infections. So there's kind of no age limit with that. And because of the fact that some of these infections can be transmitted from mother to baby during delivery, there's, you know, testing that happens even in newborns. So there's like not any age, I would say, that is specifically for STBBI testing. And if you're sexually active, then we should be testing you. In terms of then like seeing doctors for the vaccines and for testing kits, absolutely. So that's where hopefully some of those websites, if people want them after, I can pull them back up. Like showing where some of the clinics are in Winnipeg, as well as the rest of the province, to get these tests is really important, because absolutely, if you're sexually active, you should be getting, especially younger people should be getting that HPV vaccine.
See what I mean, like that? HPV.
Yeah,
What is that, and what is that about?
yeah,
You know what I mean? What is that about? And then they won't understand it. You gotta explain it really good to them so they can understand what to watch for.
absolutely. Like I think that,
So that's what that's
yeah,
my community has been doing that.
it's such a hard piece, right, on
Yeah, it is.
educating people
It is.
as to the importance of
Yeah.
these vaccines. I mean, the HPV vaccine does an incredible job of protecting women against cervical cancer, you know, but it's hard to see that when you're perfectly well. It's like any screening testing, right? It's hard when you feel well
Mhm.
to think, well, you know, why should I be doing these tests if I
Yeah.
feel okay, right?
Yeah.
So I agree, like greater education and education, like in the community is what's needed there, you know? I'll maybe pass it on so we can have time. to,
Yeah, I
like,
mean, we have, you want to explain what these are?
I mean, I'm happy to,
Because these ones are for testing, right?
yeah, so these are
I
like,
wanna pass them around.
totally, we can pass these around here to help, to look at them. So these are some of the, like the swabs. So we've got, this is one of the gonorrhea ones, it looks like, yeah, this is a urine specimen collection kit. This is like a female collection kit, so this is for again, you get a vaginal swab. If you guys want to pass them around and have a look at them, you absolutely can. And we'll send some of these around over this side.
And if people want to get closer, we can do a full demonstration of how to do the HIV self-test and the syphilis self-test.
Great.
Okay, if you want to get closer, I'm sitting right here so that the people on the camera can also see it. I'm gonna do it on myself, is that a rough practice?
He's gonna do the test on himself.
I'll do mine, I won't do anyone that's spot. So, this one is the HIV NC test, rapid detection. You can get these at High Circle. You just ask for it and they'll give it to you right there at the pit stop.
Oh, yeah.
The swab.
Yeah.
Here. These pouches, you just rip them open. You gotta make sure everything's inside. Take out the instructions, open them up. Like it's exactly like a COVID test. You open the instructions up. Look at how they are, they're very visual. Okay. See them? Online, do you see them? Very visual, they tell you what to do. You lay them out flat and then you grab all what's inside and it's this right here, another pouch. You got 3 different containers with liquids, okay? You see them? 1, 2, 3. 1, 2, 3.
Yeah.
Just want to make sure everyone can see it.
They are, they're really good, so that people can hear you. Sure.
Hear me? Yeah, good. Okay. So we have the three things, the 3 liquids. This is to poke your finger and get some blood out. And then the pouch and the other thing. Now we're gonna open the pouch. Because this is the test itself, okay? The smaller pouch, this one. Open it over. And it has to look like this. You see it? It's like a circle. Like a circle. You put it flat, lay it flat on the table. And then you start reading the instructions, okay? Because you got all your materials laid out for you. Says preparation, use a well-lit area, wash and dry your hands. I can put some alcohol actually in them. Yep. So make sure you got some alcohol in your hands or you wash them because you're gonna poke your finger and you need some blood for it. Now it says remove the cap of bottle 1 and everything's laid out. So this one's bottle 1. You open it up. Okay. And then it says collect your blood. This is what you use to poke your finger. All right. Before you collect your blood, it says you need to rub your finger to create a large drop of blood. All right. So what you do is you can just grab your finger, put it down, and start rubbing it so that the blood goes. Yeah.
I'm
So
trying.
what are you doing? What do you put it here?
Is it gonna reach?
Hello.
Can everyone hear now?
Yeah. Okay. Perfect. Sorry.
Yes.
So the only thing you missed was you open the cap, you twist the cap for the poking device. You warm up your finger again. And you just press really hard. And that should poke it. Doesn't hurt, I swear. And you want to get a good drop. You want to get a good drop that falls in here. Wait, where is it? Yeah, on bottle 1. You want to get a good drop that falls on bottle 1. Nope, don't scrape it. You got it. Someone doesn't like blood. I'm hearing some. Oh, come on. It doesn't want to fall. Oh, no, I missed. My fault. No one touch the table. Doesn't want to drop.
You got no blood there.
Maybe. I did this too many times before to test it. Maybe I took all my blood. But that's a good point from Rob. Don't scrape it. Because that goes against the directions. Oh, come on.
Come on.
Come on. There we go. Nice. All right. Thank you. That was hard.
That was hard to square.
Yeah, so you put a little Band-Aid on yourself. I swear this doesn't hurt. It's more like a pressure point that you feel. And that is what you can tell people. You put the little Band-Aid on yourself.
2. So that you don't give blood and everything, even though I might on the clip. Okay, so this is done. Put the cap on the red thing, in the red container. I'm just following the instructions as I go along. So put the red cap on. This already has some liquid in it. Okay. So now it's a bit red because of my blood. So I'm just gonna shake it 4 times. That's what it says. And for you to shake it, grab it from the top and the bottom and just do a little shake. 1, 2, 3, 4. Okay. And then it says pour the whole liquid in the test. We just open it up. Just pour the whole thing. Okay. We have to let it go down all the way. All right. And then it says, shake and pour all the liquid of the second container. This is the second container, number 2, okay? We shake 4 times again, from top to bottom. 1, 2, 3, 4. Open it up. Pour the whole thing. Okay. Then we let it sit all the way down. I can't show you because it has to lay flat, but the liquid's slowly going down. And then we just have one last container right here, which is number 3. It says again, shake it 4 times. So we do 1, 2, 3, 4. All right. And then it says shake and pour all liquid and wait until it disappears. We do the same thing. Okay. Now, that's pretty much it. We're done. What do we do now? We just wait for the results. And the results are these 3 options. So negative, if we only have a dot on the top and it's on the C, that's a negative one. Okay. A positive result in this case is if we have 2 dots, even if it's a little faint dot like this. You see that this one's a little bit fainter than this one. That means it's a positive result. And if you have an invalid result, if you don't have the top dot at all. I don't know if online you can see the bottom part there. So this one is a negative. This one's a positive, and this one's an invalid. There you go. Then I would just wait. So for me in this case, it's showing up. Let me see if I have to wait. Nope, it says read your results right away. So for me, it's negative because I only have I don't know if I can show it. The liquid might
Try and
spill.
like,
Yeah, the liquid might spill. Like
we tried. There we go.
Light's kind of crazy, but
Yeah.
yeah, you see it. There you see just one on the top. The other way. There you go. One in the top. So that one means it's negative, and that's all you got to do for an HIV self-test. So if you feel that you feel prepared enough and you want to take some and help someone or take it to any communities, now you know how to do it. Now you know that even it's literally just reading the instructions over here. I think anyone can do it. So what happens, for example, here, they also give you these instructions. What happens if my test is positive, now what? They tell you right here, okay? So what do? A healthcare provider will confirm your results and support your care. So you should if you receive a positive result, you should immediately go for a healthcare provider, right?
Yeah.
Right, that's how it.
Absolutely, yeah. Once you've got a positive test with these, right, these aren't a confirmatory test. They're right most of the time, but they're not always right. They're not perfect. And so when it's positive, you most likely, right, the person most likely has HIV, but we need to confirm it with one of those lab-based tests.
Yeah.
Yeah.
And we didn't have time for the syphilis one because I want to be mindful of your time. But the syphilis one is just like this. You poke your finger, you put it in a little test, you put some liquid in it, and that's it.
Really?
Yep, that's it. And the instructions are all right here. It's as simple as this one. So 9 Circles has these tests. If you feel like you want to take some and you want to teach someone else how to do them and they want to teach someone else, that would be the ideal scenario. Get as many people to know how to use these tests, and so we can test a lot of people. Does anyone have any questions? Yeah, if you wanna, if people wanna take some for HIV, they're over there. If not, if you have any questions, just let me know.
Megan's been for a while
Yeah.
to answer other questions. I do have the
Mhm.
session, questions, so that you don't feel like you have to stay if you have to go.
Yep.
I would say that that said different wording instead of positive, reactive.
Yes. Yes, I just use positive because this one uses positive, the test itself, but you're right.
Yeah.
The new test, this one, for example, the syphilis one, is reactive or non-reactive. You're absolutely right, Jacqueline, thank you. I just follow what the test itself says, but you're right. If anyone has any questions, just let me know. I'm in a mess over here. No one touches it, I'll clean it up.
You need,
Yeah, I'll clean it up myself.
So there's enough for her to do like one test?
Oh, and the important thing also to remember is that all these things that you use for the test, you can throw it out, it's just your regular garbage, it doesn't have to be a special one. Like a biological disposal or something. Yep. I'll just do something.
Thanks very much, Megan.
Oh, no, thanks for having
Thank
me.
you.
And, obviously, lots of questions. So. Thanks very much.
What? Here you want the alcohol there?
Yeah.
It's like a little steward.
Let me get some, have a couple more pictures.
Oh, yeah.